In the realm of antibiotic medications, ampicillin stands tall as a mighty defender against bacterial invasion. With its potent mechanism of action, it has become a weapon of choice for medical professionals battling various bacterial infections. Ampicillin, belonging to the penicillin class of antibiotics, works by inhibiting the synthesis of bacterial cell walls, resulting in the death of the bacteria. Its broad spectrum of activity makes it effective against a wide range of bacteria, including both gram-positive and gram-negative strains. This extraordinary medication has the ability to penetrate the cell walls of bacteria, disrupting their growth and replication. By targeting the bacteria at the source, ampicillin eradicates infections, providing much-needed relief to patients. As a trusted and established antibiotic, ampicillin has been used for decades to treat various infections, ranging from urinary tract infections to respiratory tract infections. Its efficacy, safety, and affordability have made it a go-to choice for healthcare providers worldwide. Understanding bacterial infections. Bacterial infections are caused by harmful bacteria that invade the body and multiply, leading to various symptoms and health complications. Bacteria are single-celled microorganisms that can be found virtually everywhere in our environment. While many bacteria are harmless or even beneficial, some can cause infections when they enter the body through various means such as cuts, inhalation, or ingestion. Once bacteria invade the body, they can multiply rapidly and overwhelm the immune system, leading to the development of infection. Symptoms of bacterial infections can vary depending on the site of infection and the specific bacteria involved. Common symptoms include fever, pain, inflammation, and the presence of pus or discharge. If left untreated, bacterial infections can spread to other parts of the body and cause severe complications. That's where antibiotics like ampicillin come into play. These medications are designed to specifically target and kill bacteria, helping the body fight off the infection and restore health. How does ampicillin work? Ampicillin exerts its antibacterial effects by interfering with the synthesis of bacterial cell walls. Bacterial cells are surrounded by a protective layer called the cell wall, which provides structural support and protects the bacteria from environmental stressors. By inhibiting the synthesis of this essential component, ampicillin weakens the cell wall, making the bacteria more susceptible to destruction. The mechanism of action of ampicillin involves binding to specific proteins called penicillin-binding proteins, PBPs, which are involved in the synthesis of the bacterial cell wall. By binding to these proteins, ampicillin disrupts their function, preventing the formation of a stable cell wall. Without a robust cell wall, bacteria become vulnerable to osmotic pressure changes and are unable to maintain their structural integrity. This ultimately leads to the death of the bacteria. It's important to note that ampicillin specifically targets bacterial cell walls and has no effect on human cells. This specificity is crucial in minimizing side effects and maximizing the efficacy of the medication. Ampicillin's mechanism of action. Ampicillin's mechanism of action can be further understood by exploring the process of bacterial cell wall synthesis. Bacterial cell walls are composed of a complex structure known as peptidoglycan. Peptidoglycan consists of long chains of sugar molecules, cross-linked by short peptide chains. This network provides strength and rigidity to the cell wall, allowing bacteria to maintain their shape and protect themselves from external pressures. During cell wall synthesis, enzymes called transpeptidases cross-link the sugar chains, reinforcing the structure of the cell wall. Ampicillin disrupts this process by binding to the active sites of these transpeptidases, preventing them from forming the necessary cross-links. As a result, the peptidoglycan network becomes unstable and unable to provide the necessary support to the bacterial cell wall. Without a sturdy cell wall, bacteria become more susceptible to the osmotic pressure difference between their cytoplasm and the external environment. This pressure difference causes water to flow into the bacterial cell, leading to cell lysis and ultimately the death of the bacteria. Ampicillin's effectiveness against different types of bacteria. One of the remarkable characteristics of ampicillin is its broad spectrum of activity against both gram-positive and gram-negative bacteria. Gram-positive bacteria have a thick peptidoglycan layer in their cell walls, while gram-negative bacteria have a thinner peptidoglycan layer covered by an outer membrane. Ampicillin is effective against gram-positive bacteria such as Staphylococcus aureus, Streptococcus pneumoniae, and Enterococcus faecalis. These bacteria are commonly associated with infections such as skin and soft tissue infections, respiratory tract infections, and urinary tract infections. Furthermore, ampicillin demonstrates activity against gram-negative bacteria such as Escherichia coli, Klebsiella pneumoniae, and Proteus mirabilis. These bacteria are often responsible for urinary tract infections, respiratory tract infections, and gastrointestinal infections. The ability of ampicillin to target a wide range of bacteria makes it a versatile and valuable tool in the fight against bacterial infections. However, it's important to note that the effectiveness of ampicillin can vary depending on the specific strain of bacteria and its susceptibility to the medication. Proper diagnosis and susceptibility testing are essential to ensure the appropriate use of ampicillin in clinical practice. Common uses of ampicillin. Ampicillin has been widely used for decades to treat various bacterial infections. Its efficacy, safety, and affordability have made it a go-to choice for healthcare providers worldwide. Some of the common uses of ampicillin include urinary tract infections. Ampicillin is often prescribed for urinary tract infections caused by susceptible strains of bacteria. It can effectively target both gram-positive and gram-negative bacteria commonly associated with these infections. Respiratory tract infections. Ampicillin is utilized in the treatment of respiratory tract infections, including pneumonia, bronchitis, and sinusitis. It can combat the diverse range of bacteria that can cause these infections, providing relief to patients. Skin and soft tissue infections. Infections of the skin and soft tissues, such as cellulitis and wound infections, can also be effectively treated with ampicillin. Its ability to penetrate the cell walls of bacteria ensures that it reaches the site of infection and eradicates the causative organisms. Gastrointestinal infections. Certain gastrointestinal infections caused by bacteria like Escherichia coli and Salmonella can be treated with ampicillin. It helps eliminate these bacteria from the intestines, reducing the severity and duration of symptoms. Other infections. Ampicillin may also be used to treat other types of infections, including meningitis, endocarditis, and intra-abdominal infections. Its broad spectrum of activity allows for its use in a variety of clinical scenarios. Potential side effects of ampicillin. Like any medication, ampicillin can cause side effects in some individuals. These side effects are generally mild and resolve on their own once the medication is discontinued. However, it's important to be aware of them and consult a healthcare professional if they become bothersome or persistent. Some potential side effects of ampicillin include gastrointestinal upset. Ampicillin can occasionally cause gastrointestinal symptoms such as nausea, vomiting, diarrhea, and abdominal discomfort. These symptoms are usually mild and transient. Allergic reactions. Allergic reactions to ampicillin can occur in some individuals. Symptoms may include skin rash, itching, swelling, and in rare cases, severe allergic reactions such as anaphylaxis. It's important to seek immediate medical attention if any signs of an allergic reaction are experienced. Superinfections. The use of ampicillin can sometimes lead to the development of superinfections caused by bacteria or fungi that are resistant to the medication. These superinfections may require additional treatment. Other side effects. Ampicillin can rarely cause other side effects such as headache, dizziness, fatigue, and changes in blood cell counts. These side effects are generally uncommon but should be reported to a healthcare professional if they occur. It's important to note that this list of side effects is not exhaustive, and individuals may experience different reactions to the medication. Consulting a healthcare professional is crucial for proper management and guidance. Precautions and considerations when using ampicillin. While ampicillin is generally safe and well tolerated, there are certain precautions and considerations to keep in mind when using this medication. These include allergies. Individuals with a known allergy to penicillin antibiotics should avoid using ampicillin. Cross-reactivity between penicillins can occur, and allergic reactions can be severe. Pregnancy and breastfeeding. Ampicillin is generally considered safe to use during pregnancy and breastfeeding. However, it's important to consult a healthcare professional for individualized advice and guidance. Interactions with other medications. Ampicillin can interact with certain medications, such as oral contraceptives, anticoagulants, and some antacids. Informing healthcare professionals about all medications being taken is essential to prevent potential interactions. Proper dosage and duration. Ampicillin should be taken as prescribed by a healthcare professional. It's important to complete the full course of treatment, even if symptoms improve, to ensure the complete eradication of the bacterial infection. Susceptibility testing. In cases where ampicillin is being considered for treatment, susceptibility testing should be performed to determine if the bacteria causing the infection are susceptible to the medication. This helps ensure the appropriate use of ampicillin and prevents the development of resistance. Alternatives to ampicillin. While ampicillin is a highly effective antibiotic, there may be situations where it is not suitable or the bacteria causing the infection are resistant to its effects. In such cases, healthcare professionals may consider alternative antibiotics to treat bacterial infections. Some common alternatives to ampicillin include amoxicillin. Amoxicillin is similar to ampicillin in terms of its mechanism of action and spectrum of activity. It is often used as an alternative when ampicillin is not suitable or unavailable. Cephalosporins. Cephalosporin antibiotics, such as cephalexin and ceftriaxone, are often used as alternatives to ampicillin. They have a broad spectrum of activity and can be effective against a wide range of bacteria. Macrolides. Macrolide antibiotics, such as azithromycin and clarithromycin, are another class of antibiotics that can be used as alternatives to ampicillin. They are particularly effective against certain respiratory tract infections. It's important to note that the choice of alternative antibiotics depends on various factors, including the type of infection, the bacteria involved, and individual patient characteristics. Healthcare professionals will consider these factors and select the most appropriate antibiotic for each situation. Conclusion: the importance of ampicillin in combating bacterial infections. In conclusion, ampicillin is a mighty defender against bacterial invasion, thanks to its potent mechanism of action. By inhibiting the synthesis of bacterial cell walls, ampicillin weakens and ultimately kills the bacteria, providing relief to patients suffering from bacterial infections. Its broad spectrum of activity makes it effective against a wide range of bacteria, including gram-positive and gram-negative strains. Ampicillin has been used for decades to treat various infections, ranging from urinary tract infections to respiratory tract infections. Its efficacy, safety, and affordability have made it a trusted and widely utilized antibiotic worldwide. However, it's important to use ampicillin appropriately, considering factors such as the type of infection, bacterial susceptibility, and individual patient characteristics. As the fight against bacterial infections continues, ampicillin remains a valuable weapon in the arsenal of healthcare professionals. Its remarkable mechanism of action and effectiveness make it an essential medication in the battle against bacterial invasion.